Now coming to the intermediate uveitis. The intermediate uveitis is basically the inflammatory cells in the anterior chamber and the vitreous chamber are found. In the anterior chamber and in the vitreous chamber we can see the intermediate inflammatory cells. In the vitreous cavity we can also found the snowball opacity. This is very much important. Snowball opacity and the absence of focal inflammatory cells and snow banking exudate in pars plana. Snow banking exudate in pars plana. Also, there is a due to the spillover of the anterior uveitis from the intermediate uveitis, it will cause the moderate aqueous flare and posterior synecdoche. Moderate aqueous flare and the posterior synecdoche. So, where it is found in 20 to 40 years age people, male and female have equal predilation, bilateral condition. Patient's main clinical feature is floaters and blood vessels. Something is floating around the eye. Floaters on the blood vessel. So what are the complications? Complicated cataract, cystoid macular edema, vitreous hemorrhage, vitreous cavity where the hemorrhage can be there, retinal detachment. Now coming to the posterior uveitis. Posterior uveitis is due to the cause is toxoplasmosis or syphilis, TB, autoimmune cause. In posterior uveitis, the patient's clinical features is floaters in the periphery, impaired vision, and it involves the fovea and the papillomacular bundle. Means in the fovea there is a impaired vision. Now the vitreous, here we can find the vitreous opacity. Why there is a vitreous opacity? Due to the inflammatory cells and exudate. This vitreous opacity can be fine opacity due to the inflammatory cells. There can be coarse opacity due to tissue destruction. There can be stringy opacity due to the alteration of the vitreous gel. There can be snowball opacity due to the large opacity. So also we can find that there is a normal anterior chamber because it is a posterior uveitis, so anterior chamber will be normal. Choroiditis is found. Choroiditis, the white yellow gray pattern chorioretinal atrophy is found. Chorioretinal atrophy and white yellow gray pattern is found in the fundus examination. So retinitis and vasculitis is also found. Periphlebitis is more common than periarteritis, and candle wax dripping appearance is found in ophthalmoscopic finding. So exudative retinal detachment is there. Tractional retinal detachment is anterior uveitis, but here we can find the exudative retinal detachment. So what is the pan-uveitis? When all the three parts combine together to form the pan-uveitis. So what are the cause of pan-uveitis? Whole uveal tract is involved. Here it is, the causes are sympathetic ophthalmitis, Vogt-Koyanagi Harada syndrome. So what is Vogt-Koyanagi Harada syndrome? Here we can find that it is basically associated with cutaneous, neurological and audiological involvement. So three things: cutaneous involvement. What are the cutaneous lesion? Alopecia, vitiligo, and poliosis. Neurological symptom. What are the neurological symptoms? The headache. Patient will complain of headache. Cranial nerve palsy, and convulsion. What are the auditory problem? Auditory problem is tinnitus, vertigo, and deafness. So these are the extraocular lesion. Now the ocular lesion will be iridocyclitis, multifocal exudative choroiditis, optical neuritis, because optical neuritis and optical atrophy is more common in the posterior uveitis. So this is all about it. It is associated with HLA DR53 and HLA DR4 association, and it is also found in sarcoidosis, panuveitis, Behçet disease. What is Behçet disease? It is a oral ulceration, oral ulcer, genital ulcer, 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 ulcer, episcleritis and retinal vasculitis, vitritis, retinal vasculitis, and other neurological and articular problem is found in Behçet disease. So this is also a neurological and uh, dermatological problem with ocular symptoms is found in the Behçet disease. So this is all about the pan uveitis and posterior uveitis, and this is intermediate uveitis. The treatment and management of these uveitis I will tell in the next lecture. Thank you.